Welcome to part 2 of Intro to Pharmacology. In addition to everything in part 1, nurses have to know more and evaluate. We have to know what the person's response to the drug is supposed to be and what we need to monitor for that response. We must know the potential side effects and adverse drug reactions and monitor for them. We must know the recommended dose range for drugs and question orders that are written outside of that range. We need to know any drug concentrations or levels. We call these therapeutic index, and they are the safe drug levels in the blood. For example, warfarin has special monitoring levels called INR, and we monitor that level closely. Heparin has PTT, and we monitor that closely as well. Some drugs like digoxin have their own drug levels. We need to monitor a patient for signs of tolerance or dependence. Tolerance is when the medication effects lessen and the person needs higher drug doses to reach the desired effect. Dependence is a physiological or psychological need for the drug. These people must have the drug in their system, and if they do not, they will begin to have withdrawal symptoms if that drug is abruptly stopped. This is very different than addiction. We'll discuss addiction further with opioids later in the semester, but addicted people display drug-seeking behavior and that they may consistently use more drug than what's ordered and needed. That is not the same as dependence. Drug tolerance is the inability to handle the side effects of the medications. Cumulative effects of drugs occur when the drug is metabolized or excreted more slowly than the rate at which it is being administered, and the drug levels in the system or the effects to the drugs are increasing. This could lead to adverse reactions. And of course, we need to monitor for drug interactions in our patients as well. With people taking many medications, this is even more important. When we look at the effects of medications, we must be mindful of the bad effects as well. We know that therapeutic effect is what we want to happen, but that doesn't always happen. Sometimes we have adverse effects, which are severe, unexpected, and undesirable effects. Think, we give a patient a medication and they die from it. That would be an adverse reaction. We can also have allergic reactions to drugs, which are actual hypersensitivity responses to the medication. We see these a lot with antibiotics, and these could lead to adverse reactions like death. We can have toxic effects where the medication level has built up to a dangerous level. Digoxin is a drug you will learn about this semester, and it can become toxic quickly. We can have idiosyncratic reactions where the drug worked a little too well or not well enough, or maybe there was an odd response to the drug that wasn't expected. And lastly, we have side effects. Side effects are predictable and often unavoidable effects to the medications. Many people outside of healthcare think side effects are the same as allergies, and they are not. For example, a well-known side effect of chemotherapy is nausea and vomiting. We know this will happen, but some people think it means they are allergic to the chemotherapy. Another one is epinephrine. Some people will say they're allergic to epinephrine because it made their heart race or their blood pressure go high. Those are side effects, not allergies. This is why it's very important to ask patients what happens when they take a medication they say they're allergic to. There are 3 more types of adverse reactions to be mindful of. One is teratogenic effects, which is what happens when a drug crosses the placental barrier and causes defects in the developing embryo. Mutagenic effects are when drugs cause genetic mutations. Some of these mutations can cause a person to develop cancer, and we would call those drugs carcinogenic. We briefly discussed how drugs can interact with each other in part 1, but there's a little bit more to it. Sometimes 2 different classifications of drugs can have side effects, and when they're taken together, those side effects can be deadly, like taking narcotics and benzodiazepines. They can both cause decreased respirations and oftentimes are given together. This combination can cause a person to stop breathing. Over-the-counter medications may have been deemed safe enough to take without a prescription, but they are far from safe. Tylenol, or acetaminophen, is over-the-counter but is very hard on your liver. If a patient is taking another medication like Augmentin, which is an antibiotic, these drugs together can cause liver failure. Motrin, or ibuprofen, is very hard on your kidneys, and many drugs are excreted through your kidneys. If you're taking 2 medications that can cause kidney damage, the person may go into kidney failure. Herbal therapies are not regulated by the FDA, and their interactions with medications is usually not known. The person could have no issues taking both, or they could die. Drugs can also interact with medications and certain types of food, so we have to be mindful of that when we educate our patients. Some drugs are also completely contraindicated with other drugs, meaning the researchers know for a fact that taking the medications together will result in something bad happening. We call this contraindication incompatibility. Because there are so many variables that affect giving medications, the drug makers have labels for their drugs. One such label are warnings and precautions. Warnings and precautions are when the drug maker lists conditions or types of patients that need close observation while on a specific drug. For example, people with liver impairment taking Tylenol. Another label is interactions. The drug maker will list other drugs or foods that may alter the effect of the drug. For example, the delayed absorption of tetracycline is if it's given with an antacid. Drug makers will list the synergistic effects, which often occur when the medication is combined with another medication, and those two medications together has a greater effect than just the medications being given separately. For example, if we gave an ACE inhibitor and a diuretic to a patient with high blood pressure, their blood pressure could drop significantly compared to how it would if they just took one medication. Drug makers will also list the antagonistic effect, which is when a second drug diminishes or cancels the effect of the first drug. For example, birth control pills can be ineffective while taking certain antibiotics. This is the end of Pharmacology Part 2.